Hello, welcome to this demonstration of completing the ambulance patient care report. The ambulance patient care report run sheet fields, page 1, and to the right there you'll see page 1. Very few fields on this page should be omitted. The more complete the report is filled out will result in better reimbursement for RAS. Missing information can lead to RAS being fined by state and/or federal agencies. Information will be necessary by you, attorneys, and/or other litigants if you are called to be a witness in a court case due to a lawsuit, either by or for the patient, hospital, or regulatory agency. The boxes in blue are necessary only if the run relates to that particular box. They are the dispatch notified, which is this field right here, the unit dispatched, that's our unit number, like 207, 208. The MCI number, that's over here, the mass casualty incident field. Factors affecting care. Patient, physician, ask the patient or family member for that information. Guardian, this is absolutely necessary if the patient is younger than 18. Preferably if they're younger than 21, you can also get it, like who's your mom or dad or whatever. Because a lot of times children are covered by insurance now, even up to 25, 26 years old. So if we can get that information, sometimes we can obtain it from the patient or the member directly instead of the child. You also want to fill in the race and ethnicity fields when appropriate. The boxes in red are always necessary unless absolutely not relevant to the particular run. For information required, you must get the information from the from the patient. You or another RAS member can try to get it from the patient. Family members, friends, police, firefighters, or hospital personnel are also possible sources to be able to complete your PCR. On the PCR, we have so many instances of this information not being completed completely. We must start getting this information. Because of the new rules that come in under HIPAA and other legislation lately, the new what we call Obamacare, so like that, there are new rules and regulations that are out there that now make it mandatory for us to get information and to have it available if requested. It's also giving providers such as Medicare and Medicaid a bigger stick, if you might want to say so, to keep us in line and make sure that this information is gathered. We can be fined for not having some of this information if we're given an audit and they find many instances of it not being completed. We can also be involved in mass monetary damages if some of this stuff isn't completed, or if they find it happens on a lot of our information. There have been ambulance services that have actually had to shut down because of the monetary damages that they've been assessed because of some of these situations. We have been very lax at this. We must get better. Instead of looking this at these fields I'm going to do this on this run, so I only need to fill this and this and this. We've got to get into the practice of looking at every field and seeing if it's related to this run or not. And a lot of these fields, even if they are not related, have an other or a no or some other field that can be checked other than one of the actual fields. So you must read the field and see if you can see that there's an other or no or whatever in there, or for some reason it's not totally relevant, then you don't need to fill it out, but notate it somewhere if you think that there might be a question later. These fields need to be completely documented. The incident address, this is where you pick the patient up. If it's an auto wreck, it's out on the highway. Get the local closest wreck. A lot of you are finding the nearest mile marker. Sometimes fire numbers we are able to use. But try to be consistent. Try to get the actual address number if at all possible, the closest residence or whatever. This is also like if you're downtown and you pick somebody up at the grocery store. Put the address into the grocery store and stuff. You need to be very consistent with all this information. We don't see a lot of times the response mode or the response request and the description filled in. This stuff is important, especially in court. If you have a situation, let's say you're on your way, you've pulled out of the garage and you're on your way to your run, and all of a sudden somebody hits you and you're put out of commission. You haven't even gotten to the patient yet. There's probably going to be a lawsuit along the way somewhere. They're going to look at this information. If you were running with lights and sirens, that's going to protect the service more than it's going to protect, even if the other person may have been in the right, quote, legally. You've got to start filling this stuff in to protect yourself and the service. Patient information, this is the actual patient you're doing the treatment on. You need all this information. Get as much as possible. Get phone numbers, ages, date of birth, and don't always just take what they say as the truth. A lot of times when they're in stress, they don't remember, or a lot of times if they're out of the area or they don't come to the area infrequently, you hate to say it, but they'll give you a false number or they'll give you a false social security number. If at all possible, try to get these numbers from actual documentation. Make sure that you write it clearly and you write it legibly. Patient, physician. This is important. Sometimes if they get to the ER and they need to know, the doctor needs to know something about the patient because now all of a sudden he's comatose or whatever, they need to get a hold of somebody for previous records on medication or the person's condition. Guardian names, again, if the child is under 18 years of age, you must get the guardian name. And if you can, get as much information like the health insurance and stuff too. So fill all this stuff in. Again, every one of these fields, even if I've got it in blue or whatever, must be filled in, and if it's not, notated as to why. Usually there's a no or there's some other reason you can check or other or whatever, but you must fill this stuff in. Fill in your attendance, fill in your first responder if there's one. Again, starting scene mileage, destination, and ending mileage. We are very bad at getting this information. Also, you need to get your times in. The response times goes in here. Every time is important. I'm suggesting that our board take and set up protocols and not just have necessarily one person responsible for this. If you have 2 or 3 EMTs on a call, then all 3 of you must, when you get back to the building, be responsible for completing all the report. And if it takes 2 or 3 people to make sure, hey, have you got the starting mileage? Hey, did you get the arrive at the scene mileage? If it takes all 3 of you in collaboration, you've got to start getting this information. You've got to start filling in these blocks. For example, let's say Diane starts as the driver to the scene, and then she's meeting another EMT there. And then the other EMT takes over as the driver and she switches to the caregiver. Then, of course, these boxes would flip for that particular person. So all of this stuff is very important, especially this page in a lawsuit if it's got anything to do with the service itself. And I hate to keep stressing that, but we're finding more and more instances, I read of it all the time, of city-owned and private ambulance insurance companies that are having to close their doors and not have service for their people, or have another service come in but it's taking longer response times because they were closed down because of a court case or not following certain rules and regulations. So we've got to make sure that we start completing these reports. Now we're going to move on to page 2. of the report. Almost no fields on this page should be omitted. The more complete the report is filled out will result in better reimbursement for RADS. This health-related information is very important in the outcome of some circumstances that can occur we have above or will discuss below. Missing information can lead to RADS being fined by the state and or federal agencies. Information will be necessary by you, attorneys, and or other litigants if you are called to be a witness in a court case due to a lawsuit, either by or for a patient, hospital, or regulatory agency. You notice there are no blue boxes on this form. All information is necessary and important if it relates to the run, even if you don't think so. The whole page is outlined in red, and the fields are all necessary unless absolutely not relevant to the particular run. I have also outlined in red the individual fields that are most likely always necessary for extra notation. So when you read through these, again, they must be checked if it relates at all. There's hardly any reason why this field would not be filled in. If not, then you'd note why. You have yes and no's. You have other fields that there's no reason why any of these fields can't be filled in. Make sure they're complete. Get a description, like chest pain or whatever the main prescription was, or description was of their care. Again, this should probably relate back to the first page where you had the reason for the call, the dispatch reason. But it may be something generic here, but it can be more specific up here, current date and time. So all of these fields, you have to start filling these in. And if they don't get filled in and there's not, you can mark in there or write in there why you didn't, or make notes in your commentary and narration as to why some of these fields weren't filled in. But you've got to start looking at them. On these things here, we find every once in a while that these are not complete. Same with this field, the initial assessment. So the initial assessment and the Glasgow coma score, you need to fill that stuff out. Patients' medications is very, very important. A lot of times we've been able to code at a better level because we see a patient medication and something in the notation that relates back to a medication, and we know that they wouldn't be taking that medication unless they had a certain condition or something. So all this stuff is important. It's not only important for us in coding, but it's also important to the emergency room that they know what's available. If you have an attached list, then make sure you reference the list to the run sheet and include it into all the documentation as far as attaching, showing in this report that I have an attachment, an addendum that lists the medications or whatever. It's all very important. Another thing we see here is these lines are not filled out completely. If you are taking a blood pressure and a pulse and the oxygen level and all that at one time, fine, that can all go in there. Put your times in. We see a lot of times missing, but fill out, make sure all the columns that are relevant are filled out. Then if you do the service again, make sure you make and fill out the next complete line. Let's say you do all the pulse and respiration and oxygen level here, and then you do that, and then you start maybe setting up the EKG or whatever. Make sure you list that and the time for that. If you do stuff over again, put it on a new line and make sure you completely fill out the line. Complete all columns and a separate line for each and every occurrence for each. Now, some services you can lump together, but for every occurrence, you've got to list it completely and give all details for it. So now we're going to go on here and let me see, where did I leave off? Medications, I said that. So remember to document due to the rules and the new ICD-10 coding coming October 1st. Please start documenting your accuracy and completing the run sheets now so our billing service can let us know issues they may see before it is mandatory and could affect our reimbursement. So now we'll go on to page 3. Again, almost no fields on this page should be omitted. The more complete the report is filled out will result in better reimbursement for RAS. This health-related information is very important in the outcome of some circumstances that can occur we have above or will discuss below. Remember, this is also very important for the health of the patient when you get to the ER. And once you leave, if they have questions and if you have documented it thoroughly, there will be better answers for them to treat the patient. Missing information can lead to RAS being fined by state and or federal agencies. Information will be necessary by you, attorneys, and or other litigants if you are called to be a witness in a court case due to a lawsuit, either by or for a patient, hospital, or regulatory agency. Again, you notice there are no blue boxes. All information is necessary and important if it relates to the run, even if you don't think so. The whole page is outlined in red again, as page 2 was. I have also outlined in red individual fields that are most likely always necessary for complete and extra notation. You should get into the habit of looking at each box for each run. Don't assume you remember what is relevant or not for a particular run. This page is probably the page that is most for documenting the person's actual health at the time and during transport. Again, this information is important for its relevance in documenting the patient's health as well as for reimbursement and legal issues. For information required you must get from the patient, you or another RAS member can try to get that from the patient. Family members, friends, police, firefighters, or hospital personnel are also possible sources to be able to complete your PCR. Every field should be completed. I can't stress that enough. Very seldom is a field completely irrelevant or does not have something that you can check to show that it's not relevant. The cause of injury and its description contributes to more knowledge in billing and showing information necessary for further uses. Documenting and asking about medications being taken, allergies, surgeries, all contribute to the biller being able to code for better reimbursement and to prevent any negative outcomes if there are lawsuits or situations such as. On this page, it is especially important to remember to document. This is where you can be very detailed in listing exactly location, like the hand, the finger, elbow, upper leg, lower leg, ankle, foot, toes, right, left, top, bottom, whatever. If you have a face injury, was it your eyes, left eye, right eye, your nose, your left nostril, right nostril, whatever, left ear, right ear. You've got to start documenting better so we can get the coding down to the exact location. If you haven't done so already, I suggest that you look at the other link that I had mentioned in here. It will also explain a little bit more about why this is necessary with ICD-10 coding. Always remember, can you as an EMT give more information than I have already given? Also, there's a box that I have circled in red that says continued or supplement, which is down here on the bottom. That can be another run sheet. If you do use another run sheet, note numbers on both on each run sheet. So the first run sheet, you'll note that you've used a second run sheet and the number, and on the second one you've noted that this is a continuation of the first run sheet and give that number. So you also want to notate the patient name, date of service, run sheet number, etc. if you are going to use an addendum on a separate piece of paper that's not necessarily a run sheet. As we look at this, again, you must go through every column for every run and check this stuff. It might not seem relevant to you, but it is relevant. Some of this stuff, if you remember it, you can go back and do it after the run, before you leave. But it must be completed and it must be accurate. You can't just fill something in because you forgot to do it. So each one of these fields. If a service is offered or the patient was checked for any of the information that should be recorded in these sections, please notate it. Remember, document, document, document. And again, patient past medical history, it's very important for proper coding, can drastically affect reimbursement. Many, many times I haven't understood, or the biller doesn't understand what is here, or would be a bill at a lower level for what they're reading until they happen to notice this information here and they say, oh, well, they've had this before, so that is what it's very logical and knowledgeable that what happened here is causing this episode. Because sometimes you say previous episode is such and such, so we'll look up here to see what happened. It's very important that you document, document, document. Again, when there's an accident that would involve airbags, this must be completed. Here you've got safety equipment. Again, if it is relevant, you'd fill it out. If not, just explain why. The receiving RN or MD, this must be signed by the emergency room, either the RN or the medical doctor. If the guardian is there or whoever is in charge of a underage child, have them sign here because you've actually got the guardian information from page 1 and hopefully notated that somewhere. In this one here, if they refuse treatment, you would have them sign the report. And then the technician, which is yourself as an EMT, would sign this one here. And again, we've got the continued on a supplemental document, either another run sheet, code numbers, or an addendum on a separate piece of paper. Make sure you notate each in reference to the other. So if you have any questions, talk to your chief and set your protocols up so that they follow rules and regulations, so we have nothing to fear if we're audited or should by some chance have a lawsuit or anything. Thank you.